Everybody can recognise feelings of anxiety, no matter who they are. First date nerves or feeling jittery at a job interview is more or less commonplace. But what happens when anxiety feels like it's taken over your life and you feel anxious but can't really define why? You could be suffering from something known as Generalised Anxiety Disorder, or GAD for short. Generalised Anxiety Disorder is a recognised medical condition, and it isn't just being a bit of a worrier. It can have a massive impact on your everyday life. GAD is different to other anxiety conditions because, unlike social or health anxiety, often sufferers can't pinpoint exactly what it is that makes them feel this way. They can be anxious in a wide range of situations rather than it being triggered by a specific event, occurrence, or memory. A lot of those with GAD say that they never feel relaxed and that there's always something to be worried about. It can therefore have both physical and mental effects on the sufferer. So what are the symptoms of generalised anxiety disorder? People with GAD can feel as though they're constantly on edge or on the verge of something terrible happening all the time. A lack of concentration and restlessness can impact on the sufferer, sometimes leading to irritability or a sudden change in mood. Now, because sufferers of GAD aren't often sure of what causes their feelings of unease, they may have a tendency to overthink and assume the worst, which is often referred to as catastrophic thinking. And due to the effects of being in a constant anxious state, there are usually a range of physical symptoms felt by the sufferer. Some of the more common physical symptoms can include heart palpitations, tension in the muscles, excess sweating and dizziness, constant trembling or shaking, feelings of pins and needles, particularly in the fingers and toes, feeling sick, nausea, insomnia, or becoming a light sleeper. So how is generalised anxiety disorder diagnosed? Unfortunately, GAD is notoriously difficult to diagnose. This is because a lot of the symptoms and feelings associated can also be linked to depression. Therefore, sometimes doctors struggle to differentiate, but usually, with some further questioning, the two can be separated and a diagnosis can be made. Your doctor or mental health professional may ask you to fill in a questionnaire with graded scales, which can help to differentiate between different conditions and aid understanding the severity of the problem. Typical questions you might be asked include: do you feel frequently tense? Do you worry about anything in particular? Is anxiety affecting your everyday life? Have you noticed more aching in your muscles with no explaining reason? Do you struggle to deal with anxiety? Do you feel out of control when you're worried? These are a few very general questions, and different healthcare professionals might ask different questions. The aforementioned questionnaires usually include questions about the past 2 weeks, but GAD is more likely to be diagnosed if you've had these feelings for over 6 months. Therefore, during the conversation with your practitioner, it's important to go into as much detail as you can about your anxiety, in particular, how it affects you and how long you've been suffering for. Some practitioners might take the time out to rule out any physical reasons for your feelings, doing blood tests and possible scans, but a lot of the time, the conversation you have with your practitioner can itself be enough. So how is GAD treated? As with many mental health issues, there's lots of ways in which treatment can be sought. This is good news, because you and your practitioner can decide which fits in best with your life and personal circumstances. The initial step that some practitioners recommend is a self-help course which they can give you access to, sometimes through a workbook, but these are increasingly becoming an online tool. You'll have regular checkups with your practitioner to see how you're progressing. Your doctor's surgery is a great place to signpost you to other services which you might find helpful, including self-help groups in your local area. For some people, this is enough for them to begin to improve. If, after this step, you haven't gained much benefit, then your practitioner might recommend a talking therapy through your local IAPT service if you're in the UK, or privately. Sometimes practitioners jump straight to this step. A couple of the talking therapies which you might have heard of are counselling and cognitive behavioural therapy. Put simply, these treatments can help you to understand your feelings and to find ways in which things could be improved, or ways to alter your behaviour or challenge some of those negative thoughts. There are different levels of these treatments, and you'll likely begin with an initial assessment to see which would be best for you. Many people have success with talking therapies, as they can get to the root of why you're feeling how you are and help you address this. Often, when this has been looked at, the problem doesn't arise again, or you know how to tackle it if it does. For some, talking therapies and self-help are not enough on their own, and may require the addition of medication to help the process. The thing about medication is that it can help alleviate the symptoms of anxiety, whilst you tackle the underlying causes. For some practitioners, medication is the first step. Although some people prefer not to take medication, this is a personal choice, and you should discuss your beliefs and feelings with your practitioner. If it's decided that medications get the green light, there's a few options which may be considered. For many, antidepressants are the first port of call, and they usually fall under the SSRI category. It's important to note that antidepressants aren't just offered to treat depression, as the name might suggest, so keep an open mind about how they could improve things for you. Alternatively, beta blockers may be used, which work with the body to reduce the physical effects of anxiety. Benzodiazepines are a sedative which can be used in cases of extreme anxiety and can provide temporary relief, so these might also be an option. Your practitioner is the best person to discuss medication with, as they'll know the specifics of your individual condition and be able to match up your appropriate medication to you. There are small changes that you can make in your daily life which will be able to help you to feel better. As recommended for a lot of things, taking a careful look at your diet and avoiding having too much caffeine are important. Regular exercise aids the brain in releasing serotonin, which is a feel-good chemical. So doing this will significantly improve your mood. Plus, it can release a lot of the physical tension associated with GAD. Smoking and drinking too much alcohol will also increase feelings of anxiety, so try to cut down or stop if you can, as this will benefit your health. And lastly, but by no means least, find whatever it is which helps you relax a little, and continue to do it. Whether it be a long hot bath, listening to music, or getting stuck into a jigsaw. If you find it relaxing, then it will benefit you greatly to do it regularly.